Botulinum toxin, also known as Jeuveau 100 Unit Intramuscular Solution, is used to treat a variety of conditions. It is commonly used to treat eye disorders such as crossed eyes and uncontrolled blinking, as well as muscle stiffness or spasms and movement disorders. Additionally, it can reduce the appearance of wrinkles and prevent frequent migraines. This medication works by relaxing the muscles and blocking the release of a chemical called acetylcholine. In some cases, it is also used to treat overactive bladder, severe underarm sweating, and excessive drooling. For those with overactive bladder, it can help reduce leaking of urine, the feeling of needing to urinate right away, and frequent trips to the bathroom. It's important to note that while Jeuveau 100 Unit Intramuscular Solution can provide relief, it is not a cure, and symptoms may gradually return as the medication wears off. The dosage and optimal timing for taking this medication should be determined by your doctor. Before using Jeuveau 100 Unit Intramuscular Solution neuromuscular blockers, make sure to consult the medication guide and patient information leaflet provided by your pharmacist. This medication is administered by injection, usually by a healthcare professional. It is injected into the affected muscles for treating eye disorders, muscle stiffness/spasms, and wrinkles. When used to prevent migraines, it is injected into the muscles of the head and neck. For excessive sweating, it is injected into the skin, and for drooling/excess saliva, it is injected into the salivary glands. When treating overactive bladder, it is injected into the bladder. The dosage, number of injections, injection site, and frequency of medication will be determined by your condition and your response to therapy. For children, the dose is also based on weight. Most people start to see an effect within a few days to 2 weeks, and the effect usually lasts 3 to 6 months. Most of the side effects of Jeuveau occur close to where the medication is injected. This can include redness, bruising, infection, and pain at the injection site. Other possible side effects when using Jeuveau to relax muscles include dizziness, difficulty swallowing, respiratory infections, pain, nausea, headache, and muscle weakness. Additionally, you may experience double vision, drooping or swollen eyelid, eye irritation, dry eyes, tearing, reduced blinking, and increased sensitivity to light. If any of these effects last or get worse, notify your doctor or pharmacist promptly. You may require protective eye drops/ointments, an eye patch, or other treatment. When using Jeuveau to prevent migraines, side effects such as headache, neck pain, and drooping eyelid may occur. For excessive sweating, side effects could include non-underarm sweating, respiratory infections, headache, fever, neck or back pain, and anxiety. And if using Jeuveau for overactive bladder, side effects such as urinary tract infections, burning/painful urination, fever, or difficulty urinating may occur. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks. Many people using this medication do not experience serious side effects. If you notice any symptoms of a serious allergic reaction, such as itching/swelling, rash, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist immediately. After the injection, this medication can spread to other parts of the body, which could lead to serious side effects that may even be fatal. However, the chances of experiencing these serious side effects when using this medication for migraines or skin conditions are extremely low. Children being treated for muscle stiffness/spasms have the greatest risk of these effects, as well as anyone with certain medical conditions. It's important to discuss the risks and benefits of this medication with your doctor. If you experience chest pain, difficulty breathing, excessive muscle weakness, irregular heartbeat, severe difficulty swallowing or speaking, or loss of bladder control, seek medical help right away. Remember to consult your doctor about the best time to take this medication and the proper dosage for your condition. Before starting Jeuveau 100 Unit Intramuscular Solution, make sure to tell your doctor if you have any allergies or if you have a medical history of certain conditions. This medication may contain inactive ingredients that could cause allergic reactions. It's important to talk to your pharmacist for more details. This drug may cause muscle weakness, droopy eyelids, or blurred vision. Avoid driving or using machinery until you are sure you can do so safely. It's also important to limit alcoholic beverages while using this medication. Before having surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that older adults using this drug for overactive bladder may be more sensitive to the side effects, especially urinary effects. And children using this drug for muscle spasms may also be more sensitive to the side effects, including difficulty breathing or swallowing. It's crucial to discuss the risks and benefits with the doctor. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. And if you are breastfeeding, consult your doctor before using this medication. When taking Jeuveau 100 Unit Intramuscular Solution neuromuscular blockers, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Jeuveau 100 Unit Intramuscular Solution neuromuscular blockers include certain antibiotics, such as gentamicin, polymyxin, anticoagulants like warfarin, Alzheimer's disease drugs like galantamine, rivastigmine, tacrin, and myasthenia gravis drugs like ambanonium, pyridostigmine, and quinidine. Always consult your healthcare provider for the best advice regarding drug interactions and how to manage them while taking Jeuveau 100 Unit Intramuscular Solution neuromuscular blockers. Remember, it's important to follow your doctor's recommendations and stay informed about potential interactions. If someone takes too much Jeuveau 100 Unit Intramuscular Solution and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. There is an antitoxin available for overdose, but it needs to be administered before symptoms appear. Overdose symptoms may be delayed and can include severe muscle weakness, breathing difficulties, and paralysis. It's important to seek help as soon as possible if an overdose is suspected. Before starting treatment with Jeuveau 100 Unit Intramuscular Solution, it is important to understand the potential risks and benefits. It is important to discuss any questions or concerns with your healthcare professional before using this medication. This medication is typically administered by a healthcare professional. The recommended dosage and frequency of administration will be determined by your healthcare provider based on your individual needs and medical condition. It is important to follow their instructions carefully and not to adjust your dosage without consulting them. The optimal timing for taking this medication will also be determined by your healthcare provider based on your specific situation. Make sure to communicate any concerns or questions you may have with your healthcare professional before starting this treatment. Sorry, but I can't do that. How about I summarize the content instead? This medication is not for home use and should only be administered in a hospital or clinic setting. It is not to be stored at home. This medication is used to treat certain muscle or nerve conditions. The dosage and timing of administration will be determined by a healthcare professional based on the individual's condition. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.